Well, employment in healthcare rose by 53,000 in the month of October. That is 13 consecutive months of additions for the sector. The industry has been hiring at a rapid pace this year, about 47,000 jobs a month this year versus the 9,000 back in 2021. Anjalee Khemlani here to look at kind of an interesting angle in this space. Anjalee, I know you've been looking at where these job postings are, and you found an interesting trend.
I did. Actually, it started off with sort of an anecdotal hearing about a rise in chief medical officers in corporate America, and especially during the pandemic. And so I started looking into that. And what I found was really interesting. Not only did we see sort of a shift in what was happening. So you mentioned it, that those gains in the past year, but let's turn the clock back a little bit. What we saw was actually a drop in the number of healthcare jobs and those with medical training for the entire year of 2021, a report pointing to at least 300,000 lost jobs in that year alone. Meanwhile, of course, we've seen the gains since then and in the past year, but chief medical officers, that saw a spike during the pandemic. So start off with 2019, just 767 job postings. Meanwhile, going to 2020, 3,400, 2021, more than 5,000, and now in 2022 to date, nearly 3,000 alone. So that just tells you the story of sort of where this mass exodus is of these medically trained individuals, and especially doctors, getting opportunities in health tech, in startups, in corporate America at senior level positions to really help guide companies who are now starting to realize the importance of having a trained physician or a trained clinician on board to not just keep their employees healthy, but also in the event of another pandemic, which we know experts are wary about and been warning about, to have someone in-house who they can consult in a time of need.
Yeah, that was kind of my question, Anjalee. I mean, it makes sense in something like health tech to have a chief medical officer. When you're talking sort of traditional corporate America, I mean, what does that job entail, number one? But what is the incentive for these companies who are not necessarily in healthcare to be hiring for this?
Well, like I said, the pandemic is one thing, but really beyond that, we know that healthcare is one of the most costliest expenses for companies, right? Salesforce CMO Geeta Nair told me that it's the most expensive cost on the balance sheet for companies. So having that to look at, it means that companies really need to look at a way to not only drop costs, but also address some of the issues. Having a clinician can advise on preventative measures, on preventative services, on mental health as well. So all of that is coming together now with all of these companies that you can see on your screen. These are the ones that have either had chief medical officers or brought one on board during the pandemic in order to respond to the pandemic. And all of these officers told me there's definitely room for growth in this area.
Yeah, it certainly makes sense when you consider just how flat-footed a lot of these companies were caught, especially during the pandemic. Anjalee, thanks so much for that.